course, welcome. On behalf of Dr. Stephanie, I want to welcome you to our talk this evening. I know with the monsoons and rain, it's kind of hard to take the time to get away, but we really appreciate you being here, and of course, for taking the step towards being proactive about health and keeping your athletes healthy.
Absolutely. So, first of all, so I just want to ask a few questions. Who in here has had a sports-related injury? All right, so everybody has. Awesome. So we'll kind of get into that, talk about that. Have your kids had any injuries?
Mostly overuse.
Okay.
My ballerina has a lot of tennis, like with her Achilles.
Absolutely.
And then I feel like Lily, we sat her for a long time for her knee.
Mm-hmm.
But nothing where we're like in next week. One time we did think she broke her like toe, like right here,
Okay.
but that wasn't from sports. It was at a sport event.
Of course.
It was at nationals. I'm like, don't play sharks in that.
Yeah.
Barefoot.
Alright, so we'll get into a little bit about ankles and stuff here too. And then, Javi, you still have a shoulder issue?
Yeah, I have a torn labrum, self-diagnosed torn labrum, but no imaging. And I've had ACL reconstruction, meniscectomy, and then same thing on the other side, minus ACL, so meniscectomy,
Absolutely.
and
Okay.
other stuff,
Okay.
ankle sprain, all that.
And I'm sure you see a lot at the gym too.
Yeah.
A lot of kids.
Yeah.
What are some of the biggest things that you see?
With like so we have a good amount of volleyball players. It's usually overuse, knee or shoulder.
Okay.
I had two this summer, two post-op, kind of post-rehab ACL between back to return to sport and then, discharge from PT.
Right.
So they were about from like month 6 to clearance is where I saw them. And then I would say we also get a lot of ankle sprains, things like that.
Yeah. And then Justin, how about you?
High ankle sprains, a lot of softball-related injuries. It's interesting how much injuries you get playing softball. Then motocross, I did that a lot when I was younger too. So I smashed my arms up and legs, and I had sticks literally sticking in my arms, and all those kinds of things. Luckily, nothing too serious. Now, when I was about 10 years old, I did crack my skull. That was a bicycle accident, and so. But
No helmet?
no.
All right, well, we'll be getting into a lot of things, cover ankle, shoulder, knee, and then a lot of rehab and preventative medicine today. So I think you'll get something from that. So we also want to discuss real quick just a case that we've collaborated on, and Dr. Romero's going to touch on that.
Sure. So let's call her Rachel, since we have to protect her identity, but a middle school athlete, track and cross country, who actually competed at a really high level. She was even beating high schoolers she was going up against, and she was having some overuse injury or injury with her hip and knee and lots of pain. And the first approach I did with her was focus on nutrition and some specific supplementation to help reduce some overwide body inflammation. We worked on things like kinesiotaping, cupping therapy, acupuncture, even trigger point therapy to help with healing the muscles, tightness and pain in the muscles. And once we got her pain down and she was overall feeling better, restorative reduction in inflammation, now it was time to focus more on strengthening and stabilizing her joints, which is when I referred her to DPT.
Yeah, so we were able to actually find some weaknesses in her hips that were contributing to some pain and imbalances down the chain. So we worked a lot on gait mechanics and hip strengthening, and she ran PR this year. So success story there. So what we are going to be learning today are kind of what we mentioned: common injuries, easy ways to warm up, and Dr. Romero will come in and talk about nutrition, sleep, role of medications and supplements, and then home care. So first, we're just to clarify, these aren't all specific to each sport, but we do commonly see shoulder issues in volleyball players, softball as well. So one of the things that we see commonly is called shoulder impingement. Does anybody know what that is? Shoot, I already showed you. No. So basically, one of the muscles of the rotator cuff, typically this one on top, can get irritated underneath that bone there. And that's typically caused by some rotator cuff weakness or problems with the scapular mechanics or the shoulder blade mechanics as they're raising overhead. So typically people will feel pain when they're reaching overhead, sometimes with sleeping on that side, and it won't necessarily be like a big inflammatory component or anything, any clicking or popping, but it'll just be this irritation when they go overhead. So a lot of times in volleyball players, you have to spike the ball. So when we address this as physical therapists, we look at the strength of the rotator cuff and look at the movement of the shoulder blades. Has anyone seen, maybe in some of the climbers, you see their little shoulder blades like wing out?
Yeah, big old lats.
Yeah, and then the small muscle called the serratus anterior should be controlling that shoulder blade to stay on the rib cage. A lot of times we'll see that it's not as strong as it needs to be, along with some of the lower traps, and that can contribute to some movement of the shoulder blade. Tipping forward, also combined with tight pecs, and then that can cause more irritation of that rotator cuff muscle, and that's where you get that pinching as you go overhead. So, for examples of shoulder warm-ups, so one of these is called CARs. These are just some ideas, and in the handout you'll get some descriptions of these, but one of them is called CARs. So that's just working on controlling the rotation. So you just kind of raise your arm up, turn that thumb out, and then come back down. And there's a few different ways to do this, but trying to just move that shoulder around without getting that pinch. And then bear crawls here, that'll work that serratus muscle. So the goal is to have control of your shoulder blade muscles. So instead of just kind of letting them wobble around, you can't shoot a cannon from a canoe. So if your shoulder blades aren't stable, you're not going to be able to generate much force when you throw or when you do anything else, and that's going to lead to more friction and can cause some irritability at the shoulder. So bear curls are really good. It's a great core exercise too. Push through those shoulder blades, try not to shrug up, and you'll get some of that serratus muscle, which keeps your shoulder blade flat on your rib cage. And then that's another one I like to use, band external rotation or band ER. You're getting rotator cuff as well as low traps on that one. It's surprising how hard this can be if you just grab a band, pull your shoulder blades down and back, and pull that band apart. So those three can be a really good warm-up. It could be for climbing as well. All right, so ankle sprains. They're common in volleyball, football, really anything where you are jumping and then you land. So what is it? It happens primarily when this ligament, anterior talofibular ligament, gets torn or stretched from that outward roll. Less common is when the deltoid ligament on the inside gets stretched or torn. I actually got a sprain falling from climbing, did that to mine. So that one's less common, but the idea is the same, that the ligament gets stretched or torn. There's grades of this, so sometimes you'll roll it like when you're running and it's just swollen for a day or two, you're back in a day. Some people have to take 2 or 3 months off because it's swollen, they might be on crutches. So different grades for this. You guys have had ankle sprains? Everybody? Did you do physical therapy or anything after? You did? Awesome. Most people don't. So commonly see, it's awesome. Your body does heal, of course, but once it's torn, these little receptors inside the ligaments don't tell your brain where your foot is at in space as well anymore. So you're more likely to re-sprain after that point, just because you're not getting as much communication from that ligament to your brain to help correct when you do roll the ankle.
Is that even with proper PT?
No, that would be without PT. Yeah,
okay.
Typically in PT you'll do some like balance, proprioception exercises where maybe you're standing on one foot, eyes closed, and trying to get that proprioception back or that awareness of where your foot is in space. Is that what you did?
Yeah, a lot of that.
Okay. So oftentimes you'll kind of know when you sprain your ankle. It's gonna be bruised, swollen, you'll have pain on the outside. And why does it happen? A lot of times it's a freak thing, the initial one, but subsequent ones are typically because of that decreased ankle strength and awareness. So good ankle warm-ups. You'll see a lot of these cars in here. I just like these because, and I think you guys, I've seen some of these.
We do a ton of those.
Yeah, I love them because you're just working on controlling your range of motion. It's not like just stretching and then going back to your day-to-day life. Because if you just stretch and you don't actually strengthen or learn to use that range of motion, you're not going to change anything. So just sitting here, basically just controlling ankle circles and not letting your knee move. So it's just at the ankle joint. Heel and toe walking, just get some activation of the calf muscles in the front of the leg there. And then ankle windshield wipers. These are primarily for what are called the everters of the ankle, so the ones on the outside. When you you end up stretching those. And so it's important to strengthen those back up. Commonly starting off, if you're irritable with a seated position, then you can move to a standing position, but just to help decrease your risk of freeze-breathing. All right, last but not least, knee pain. This is common in runners. I see this a lot, especially in middle school runners. I had this when I started cross country in middle school. When your kneecap gets inflamed and there's some irritation behind the kneecap, that's called patellofemoral pain syndrome. It's common when you have tight or decreased mobility in your quadriceps, as well as some decreased strength in your hips. A lot of times with runners, when we'll look at their gait, we'll see young runners, females, will see kind of this inward motion that can put a lot of tension on the inside of the knee and compression on the outside, and then your quads are pulling on that kneecap, and you get some of that irritation under the kneecap. And that's typically what they'll report is like the pain is right here. There was no trauma, so you can rule out like an ACL tear or meniscus tear. It's commonly just right around and under the patella. So running will irritate it, walking up and down stairs, sitting for long periods even. And to address it, we typically strengthen the hips, doing that push down. And then also work on mobility at the hips. The knee oftentimes becomes a victim of what's going on at the hips because the muscles of your hips can directly control this bone. It's right down here, right? So if there's strength imbalances here, instability here, then there's going to be increased movement down here. So I'll start out with, again, hip cars. I like to do them on hands and knees just because there's a little bit less variability. And then moving to something called lateral toe taps, where you strengthen the outside of the hips. Again, just less variability. You see a lot of people doing like the monster walks. And I like the toe taps just because you get people to really feel those glutes a little bit more. And then a squat with a band, again, to bring in the glutes there. And then just to touch on the role of strength training, all athletes, really actually I think all individuals should be doing some level of this. So in my experience in cross country and track, we didn't have good strength coaches. They had us doing bicep curls, even at ASU. Like that's not really necessary for us. We didn't do a ton of leg stuff. So just all of the research supports this for pretty much all levels of athletes. And if your kids or even if you don't have a good resource for this, Hobby would be someone good to talk to. There's a lot of schools I think have their own strength and conditioning programs, but they may not touch on everything that you need. And especially over the summer when kids don't have as much going on, they should be doing some sort of strength conditioning program. And it should include progressive loading and systematic loading and not just kind of be willy-nilly throwing things at you, lift as much as possible. So just wanted to emphasize that. Dr. Kelly will take over from there.
Thank you. Okay. All right, so as Dr. Stephanie mentioned, there's going to be a handout with all the notes, so don't worry about trying to put everything in memory, and I'm probably going to go a bit fast because there's a lot of info, but most young athletes, adolescents, aren't the best eaters, right? Maybe not make the best food choices, so when it comes to daily nutrition goals, there really should just be three main takeaways, whether it's they're trying to do keto or intermittent fasting or vegan diets, whatever it may be, there's three things. So healthy fats. Healthy fats are going to help with modulating inflammation in the body, which is really important for recovery from workouts. And healthy fats are nourishing for joints, muscles, and nerve health. And then mental focus and clarity. Mental focus, that cognitive function for athletes, I think is maybe underserved, but particularly for concussion management and recovery. People with high diet of healthy fats have a little bit better recovery and protection from concussion or traumatic brain injury. So especially with football, even volleyball, concussion management is really important. So healthy fats help with that. Lean proteins. There is quite a difference in the nutritional and health value of grass-fed beef versus grain-fed beef. Grass-fed beef can actually have similar healthy fats as a piece of salmon. So when you want something that's not going to cause inflammation or cause disruption with quality of product, you want to choose grass-fed over grain-fed. Wild versus farm-raised, same thing if you're concerned about heavy metals or sustainability with fish. And of course, plant-based sources like legumes, nuts, seeds, and so. And then colorful fruits and veggies should be the third key point when it comes to daily nutrition. I like to say eat the colors of the rainbow. It's going to give you the best variety of your antioxidants, vitamins, minerals. If you're not sure which ones you should eat versus organic or not, the environmental working group does have what's called the Dirty Dozen. So it's the worst pesticide-ridden produce, and then they have what's called the Clean 15, so ones that you don't have to buy organic. And then, of course, some common micronutrient deficiencies I see with a lot of athletes. Athletes, they burn through their vitamins and minerals. They're under a lot of stress with training and school. So commonly I see zinc. Zinc's really important for wound healing. So if there's an injury and you need to repair meniscus, cartilage, and tendon ligaments, seems to be really key. Also good for immune health with cold and flu season coming up in the fall. Vitamin D is also another common micronutrient deficiency. Very important for hormone health, of course, bone health when we think of vitamin D. And another thing too, it helps modulate body-wide inflammation. So unfortunately, 75% of the population or so is deficient in vitamin D, so that's an important one. And then DHEA, it's a type of omega-3 fatty acid, again, brain protection, concussion protection. And then B vitamins for energy, metabolism, B12, biotin, folate, and then electrolytes. So this one I think is really important, especially for Arizona in the heat and training football. We're concerned about heat stroke, heat exhaustion. So we can drink a lot of fluids, lots of water, but you're losing a lot of your electrolytes in your sweat. So if you're not really replenishing those, you could just be hydrating with fluids, but then you're actually depleting your levels of sodium and so on. So you could be overhydrating with not adequately replenishing electrolytes.
Can you recommend a good electrolyte? Like my husband, he was out climbing and they're getting so dehydrated, but he doesn't want to just drink Gatorade.
Yeah, absolutely. And especially when we're concerned about some of the electrolytes on the market that have artificial coloring and sweeteners, you really want to try your natural. So
I hate buying all of it.
yeah, absolutely. I do have one. I can send you the information afterwards for sure. Okay. So this one's a pretty common question I get about pain relievers, whether they're over-the-counter, ibuprofen, Motrin, versus some natural ones. So the non-steroidal anti-inflammatories, the over-the-counter pain relief medications, here's my concern with them is if you're constantly taking them as a prevention measure, you can actually be blunting your body's natural immune response to heal. So inflammation is actually a good thing in moderation. That's how we adapt and how we improve on strength gains and things like that. So if you're constantly taking these, you're actually stopping your body's ability to get improvement and heal and regenerate. So the other concern is when they block inflammation, they could also potentially be blocking your body's ability to lay down new collagen. That we need collagen for repairing joint injuries. So if you are an athlete, you hurt yourself, and you're constantly taking these medications, you actually could be doing yourself a disservice. So the other concern with a lot of these and overuse, especially teen athletes, is the digestive health. It can affect the gut lining, that protective barrier in the gut, which can lead to malabsorption issues, can lead to ulcers. And you think of ulcers.
Question: what's your thoughts on like capsule form of collagen versus like bone broth or yeah?
I'm actually going to get to that in a future slide, but we'll touch on that. But yeah, so ulcers, we usually think of older individuals, but we're actually seeing an increase in ulcers in kids, not just because of the stress from exercise, but even mental, emotional stress from trying to get their grades up and things like that. The natural pain relievers. So curcumin and capsicum come from turmeric, red pepper, like cayenne. Those are much gentler inflammation modulators than the NSAIDs. So it can still do a great work on modulating that without really blocking those major pathways to lay down more collagen for joints. The other great thing about them is they've been shown to address two compounds in the body that are responsible for the pain receptors and pain signals. So those can actually be a really great natural option. Arnica montana is a type of flowering plant. There's oral and topical versions. It's really good for the typical bruises, aches, and pains, kind of just general wear and tear when we work out or go through practices, things like that. Magnesium is a favorite one of mine just because it is a natural muscle relaxer. So when there's muscle cramps, muscle spasms, this works wonders. Plus it helps with sleep. So I'm going to talk about sleep later, but if you're an athlete, you need your sleep. And then enzymes. So people think of digestive enzymes when your stomach's upset, but there are proteolytic enzymes that actually help with the metabolic functions of the body, and particularly for injuries, if you're recovering, enzymes help with reducing edema, so swelling around a joint as well as scar tissue buildup. Okay, so supplements. Hyper, folks, answer is it depends on the individual, but the thing I caution with all of these is that if you're going to use any supplementation, you do want to make sure it's physician grade or physician approved. There's a concern with a lot of products that are sold over the internet that could be fraudulent products or products from out of the country that might have contamination with heavy metals. So it really does depend on the brand, the quality, and the dose. So branched chain amino acids, which are really popular, they're isoleucine, leucine, and valine. They are great for muscle function, muscle recovery. Creatine, it's great when you cycle through. You really want 2 or 3 months on and then a couple months off. It should be a cycling type of supplementation. You have a smaller dose that you work your way up to a higher dose, and it really does help balance that pH and acidity in the muscles when you get that initial soreness after a workout. Collagen and bone broth. All right, so I'm more of a fan of the mixed collagen types for a powder rather than capsule. It can be a great option if you're not really getting it in the nutritional aspect of your day-to-day life. So bone broth, you can make your own or buy some. The bones, I am particular about where they come from. So you want grass-fed beef. If you're going to do the chicken, you got to be cautious because there's concern about arsenic and other heavy metals with chicken bone broths if you're going to buy them. So if you have a crock pot, you can easily mix them at home. Get the bones from a local butcher that's local grass-fed beef is a good option. But I do think it really can help support that process for healing and joint repair. I will say that collagen, connective tissue in general, heals really slowly. So if you have an injury, you're looking at a good 3-4 months to even get to the point where that tissue might be stronger again. Protein powders, I think are great. You really want 20 to 40 milligrams per serving. Anything more than that, you're really not going to utilize in that one sitting. Nitric oxide precursors. Okay, nitric oxide is known to be a blood vessel dilator. The idea is increase your blood vessel circulation, increase blood flow to muscles, more oxygenation, better oxygen, or better muscle activity, as well as fighting muscle fatigue. The concern I have with nitric oxide precursors out there is that a lot of them are paired with the caffeine boosters and energy drinks, and this can be very dangerous for young adolescents. Even the Journal of the American Heart Association published some research this year stating that deaths and emergency room visits have increased from energy drinks and causing cardiac rhythm issues and high blood pressure. So I know athletes want to try to get that extra motivation and energy boost, but you really want to stay away from a lot of those caffeine and energy drinks. And then I already talked a little bit about electrolyte replacement. And then antioxidants. So antioxidants, we think of oxidative stress, and the antioxidants are a good thing, but you don't want to overdo it because, again, stress is how our body naturally adapts and improves. So if you want to do more antioxidants, things like NAC, glutathione, those really should be done in the later part of the season. In the first half of the season, you're trying to get back your endurance up, your strength up. You may have been gotten out of shape like being at the end of your off season. So if you're doing too many of these in the beginning, you're again blunting your ability to improve. So you want to maybe use these when you're supposed to peak at the end of the season. All right, rice is out and much is in. This is one of my favorite things to talk about. Rice, rest, ice, compression, and elevation. It's a kind of an old school thought when it comes to injuries. So the research out there's actually not much, and the research that's out there, it's not very supportive of rice being that effective. So in the first 24 hours of injury, yes, ice and cold can help modulate some of that swelling and inflammation, but after that, you want inflammation to heal. So if you're constantly doing ice, you're actually restricting blood flow and the good nutrient and oxygen your body needs to heal. So that's why I like much. So M for mobility, meaning you want active range of motion, you want to keep the flexibility there. Motion is lotion, which we like to say. If you keep the joint stiff and you're sedentary, you can be doing yourself a disservice. So getting back into range of motion activities and flexibility, stretching sooner rather than later. Up still stands for elevation, so that's okay. Cold and heat. So now we want alternating hot and cold. This is going to act as a pumping action with the blood flow, so blood flow in, nutrients and oxygen, and then metabolic waste with blood flow out of the injury site. So alternating is, and with a hot and cold, is going to be a much better effective point for healing and faster recovery.
Quick question.
Yes.
When do you, because I've heard different stuff, when for that contrast therapy, do you start that immediately post-injury or do you wait?
I wait, the first 24 hours I'll do just the cold, and after
Okay.
that I'll start incorporating the heat.
What's the difference between ice and cold?
Well, I guess kind of any kind of cold therapy. So cool packs, ice packs,
Okay.
things like that. Yeah. Try to make with that. There are different acronyms nowadays. So much was one. There's one called METH. It's movement, elevation, traction, heat. Meth, yeah, I don't want to say do math. You don't want to do math,
No.
right? There's also, instead of much, there's chum, but it's not as popular. All right, so in the handout that we're going to be emailing you, there's some more details about sleep hygiene, but sleep hygiene basically refers to the rituals and habits that you do before bedtime to help improve your sleep quality and to stay asleep. So, again, athletes are the accountable ends, right? They are trying to keep their grades up. They sometimes work jobs and they're training. The thing that tends to go first is sleep. They cut their hours back. They're sleeping 4 hours a night, which isn't enough. And for an athlete, this is really important. So your natural hormones get boosted at night. Your injuries aren't going to repair as well, so tissue repair is really important when you're sleeping. And then, of course, cognitive health. How can they focus not only at school but on the field if they haven't had sleep and their cognition's not there? And then, of course, the handout's going to have more details, but as an example, especially for teenagers, iPad use, laptop, iPhones, that blue light is going to affect their ability to go to sleep. You don't want that blue light exposure right before bed. Okay, so alternative complementary treatments, acupuncture, cupping, and gua sha or grasping, those are really common Chinese medicine techniques, and they become really popular among younger athletes because they're pretty minimally invasive. There are ways to help improve blood flow to muscles and joints, help with the tightness and restrictions, and most of the time people feel pretty good with them managing with pain. Nutrient IV therapy, have either of you heard about nutrient IV therapy? Anyone?
The IV drips that people get?
Yes.
Yeah.
So those are commonly used for exercise recovery and hydration, but I do caution using it with younger, pediatrics in a sense, middle school and high school athletes. It really should be a case-by-case basis, and if it's not something that's really implicated, like there's gut health and malabsorption issues, you should be getting most of their nutrients from the nutrition. If that is a concern, I know I talked about micronutrients earlier, but the specific micronutrient testing out there are blood tests to see if the body's not absorbing what it needs to or it's actually lacking in the diet. So micronutrient testing is something that can be done with or without insurance. Cryotherapy and cold plunges. So I know I talked a little bit about cold earlier, but I'm still a fan of cryotherapy and cold plunges. Whole body cryo or whole body cold plunges can be great. It's about the timing of when you use them. So in my opinion, I think it's used best when it's about 24 hours after a really intense practice or competition. So you really want to do it right after because your body still needs to go through that inflammatory adaptive process after those intense workouts. So 24 hours later, that's when I like to see my athletes do that and have the best results as far as recovery and healing. Trigger point therapies, massage therapy, trigger point injections, those again are super popular and pretty effective for maybe muscles that might be overworked. Regenerative joint injection therapies. So platelet-rich plasma like PRP, prolotherapy. Are these sounding familiar at all? No? Okay. So these regenerative injections are, in a sense, more natural injections that are the opposite of what a cortisone shot does. It can actually help heal tissue. So torn ligaments, torn rotator cuffs, meniscus tears, things like that, even cartilage. It can help actually re-heal those areas. All the research is really done on adults. There's not much on pediatrics, and it's something that really needs to be researched further. So I would caution against this unless it's an isolated incident that you would discuss with, of course, your athlete and their physician. All right, and of course, for attending today, we just want to say thank you. So I am offering a complimentary 30-minute cupping session for you or your athletes.
And then we'll also be offering a free 30-minute discovery session. So what we do in that is just kind of see what's going on. It could be anything. We work with people with athletes with leg pain, hip pain. We see a lot of people with chronic low back pain who have done other things. And we're a little bit different than typical physical therapy clinics in that we spend 1 hour one-on-one, which it helps to get to the root of the issue. So we have a free 30-minute discovery session offer for being here today. So thank you for coming. And then we can stick around to answer any questions that you might have. Doesn't have to be about what we went over, anything that you've got going on, or if you have any follow-up questions for today. Any questions right now?
There you go. It's not like on the top of my head.
So when usually, the thing that I've gotten a lot is when